Pooh is aged 4 years and 9 months. His weight is 14 kilograms. His temperature is 38 degrees. His mother has brought him to the clinic because he is sick with a rash and fever. First check for general danger signs. The mother says that Pooh is able to drink, is not vomiting, and has not had convulsions. Now look at the child to see if he is lethargic or unconscious. Write down your assessment. Does Pooh have any of the general danger signs? Now assess Pooh for the first main symptom of cough or difficult breathing.
Does the child have cough or difficult breathing?
Pooh has a cough. Therefore ask,
For how long?
Pooh has been coughing for 7 days. Count the breaths Pooh takes in 1 minute. Prepare to start counting. Start counting now. Stop counting. Write down the number of breaths you counted and decide whether Pooh has fast breathing. Now look for chest indrawing. Write down whether chest indrawing is present. Now look and listen for stridor. Look and listen now. Write down your assessment. That completes the assessment process for cough or difficult breathing. Now use the information to classify the illness. Ask about the next main symptom.
Does the child have diarrhea?
Pooh does not have diarrhea. Therefore, ask about the next main symptom.
Does the child have fever?
Pooh does have fever. He lives in an area with a high risk of malaria. Next ask,
For how long?
Pooh has had fever for 3 days. Ask,
Has the child had measles within the last 3 months?
The mother says she thinks Pooh has had measles since last week. Look for a stiff neck. What is your assessment? Does Pooh have a stiff neck? Next, look for a runny nose. Does Pooh have a runny nose? Look for signs suggesting measles. Look for a generalized rash and either a cough, runny nose, or red eyes. Does Pooh have a generalized rash? You have previously been told about Pooh's cough, and you have already checked for a runny nose. So next, look for red eyes. Does Pooh have red eyes? What did you decide? Does Pooh have measles? If you believe that the child has measles, you should continue the assessment at this point to assess the child for complications of measles. Look for mouth ulcers. What is your assessment? Does Pooh have mouth ulcers? If he does, are they deep and extensive? Look for pus draining from the eye. Write down your assessment as to whether there is pus draining from either of Pooh's eyes. Look for clouding of the cornea. Can you see clouding of the cornea? That completes the assessment process for Pooh. You should now have sufficient information to classify the illness. Choose the appropriate classification for Pooh and write it down.